Hello, everyone. I hope all of you are keeping well. I'm Sauraveshwar, Sen from Catalyst, welcoming all of you to this session today. Thank you for joining in and supporting our endeavor to create more awareness regarding the social development sector for all of you. At the onset, I would like to share a little anecdote about what we do at Catalyst. Catalyst Learning Services was established in 2011 in Kolkata, India, with an aim to create prospective human service professionals who will enable people overcome poverty, deprivation, and unemployment. Today, the Institute keeps the vision alive through extensive online teaching, research, policy support, and field action program. Every year at Catalyst, by enabling students all across India, working professionals, graduates to successfully qualify the bachelor's, master's entrance tests, interviews, MPhil, PhD support for social science programs and fellowships, we continue to produce committed, high quality prospective professionals in a range of social and human development sector. Law and justice, health, mental health, social epidemiology, clinical psychology, education and vocational skill development, human resource management, media and cultural studies, rural and urban development, livelihood and social entrepreneurship, climate change, disaster management, public policy, regulatory governance, focused work on women, children, adolescent, youth, aged, disability studies, inclusivity, and sustainability. Over the last 1.5 years, um, the type of learnings that all of us across the world we have acquired definitely points to the very simple and fundamental aspect that most of us grew up to, is that health is possibly the only constant wealth in of our lives. And to talk truly about how critical health is and how important it is to create health support infrastructure, we are delighted to have amongst us Debrishi Brahma. Debrishi is a public health professional currently working as research and community coordinator of Hopscotch Health, a Mumbai-based digital health startup. Debrishi develops and refines digital tools for health behavior change. And we would love to know like how Debrishi connects the behavioral aspect of health in this session. Debrishi did his master's in public health, social epidemiology at the School of Health System Studies, Tata Institute of Social Sciences. Prior to that, Debrishi graduated from the West Bengal University of Health Sciences as a dental surgeon. Debrishi has worked in public and private hospitals like SRIMS Durgapur, Ishpat Cooperative Hospital, CNMCH, and NRS Medical College, Kolkata. He currently volunteers with Plexus India Foundation, a non-profit conducting research and advocacy to support skill building and employment creation for GSM communities, and is one of the moderators of the West Bengal COVID Action Network, WBCAN, a youth volunteering COVID support initiative. Debrishi is passionate about health communication, health policy, analysis, behavioral science, health of GSM communities, and is also a mental health advocate. Debrishi, thank you so much, firstly, for taking out your time and being with us to share your story with many of these participants who have now joined to listen and interact to you. Before we start off the session, a quick sort of a note which I want to share with all of you is that uh, Debrishi right now is working from his hometown in Behrampur, and he was actually telling me that how starkingly contrast a picture it is, to be in a developed city like Mumbai compared to, say, maybe a town where he is from. And this also would be one of our central idea of discussion with so many participants, Debrishi, who I'm sure are also joining from different parts of the country. So my request to all of you is that Debrishi has been clearly telling me that he really is looking forward to interact with all of you, listen to your questions and queries, and try to knit that with his experience in helping you understand how you move forward. So I would request all participants to be as interactive as possible in this session. Use your chat box if you want to ask questions. We would love to answer as many questions as possible in this session. If required, and if Debrish is comfortable with, we would even be requesting you to use your microphones if required, that you can ask a question, you can raise a query. And we would love to see that this session starts as and becomes like a starting point for all of us to look forward to the health sector in a very constructive way. And without any further delay, I would like to hand over the session to Debrishi. Thank you so much once more to take out your time, Debrishi. Over to you.
And thank you for inviting me and having me here.
Our
It's
pleasure.
a wonderful opportunity to talk to so many young people at the same time about something that I am passionate about. So I think because you started off by saying that health is wealth, I would like to actually know a little before we go into the details. What are your conceptions of health? Like, if you could share on the chat box, or if you want to even share your ideas by speaking up, that would be immensely helpful. Anyone?
Can I say something?
Sure, sure. Go ahead. Hi. Somebody was saying something. Okay, prevention and promotion of overall well-being. Great. Anybody else? Health is most important for a healthy living lifestyle. Absolutely. Anybody else? Any speakers?
Hello, sir. Can I say?
Yeah. Sure, sure. Go ahead.
Yes, sir. We can start off with the definition of health. Hello.
Mhm. Yeah.
It's physical, mental, and social well-being, and not just the absence of disease or infirmity. So it's a
Mm-hmm.
holistic concept. Everything has to be in place. You cannot have one part missing in your lifestyle and say that you are a healthy person. There should be a good physical fitness as well as mental health and a good diet and
Mm-hmm.
good, I guess, socio-political atmosphere around you. That's a
Mm-hmm.
holistic concept of health.
Mm-hmm. Fantastic. Thank you for
Thank you, sir.
sharing your views, Siddhi. I think we have a lot of other comments as well. I'm going to read out. Health is our first prosperity. When we don't have a good health, we don't achieve anything. Absolutely. This somehow reminds me of Amartya Sen's capability theory. Our ability to take care of ourselves. Health is absence of disease. Yes. Health is a complete mixture of diet, physical fitness, and mental well-being. um, yes, health is well-being of mind and body at the same time. Health is all about diseases and its prevention. Health is a right. I'm so glad to see this statement. Health is a right. Healthy mind lives in healthy body. Absolutely. Anybody else want to share anything before we go into the main discussion? This current situation tells how wealthy a person if he is healthy. Absolutely. Health is a real wealth of human being. Correct. Okay. So I want to before I go into the conceptualization of health that I want to show you guys, I would like to say that you, of course, I think the variety of definitions and the variety of ideas that all of you have shared till now about health is all correct, and it's a, of course, a complex concept. At the same time, it's also important that health is to some extent in our hands. It's also a product of where we live, how we live, what all we have access to. So these are the concepts that are important when it comes to health. So I have a couple of, let me share my screen. Um, is this visible? Is the screen visible?
Yes.
Great. So I think I will start by sharing what public health is. I'm sure that after the COVID pandemic, a lot of us are reading and hearing about this term, what exactly is public health. And we are talking about how spending more for public health is important in order to help people out there. And lastly, I think what has brought us here today is that we want to understand about careers in public health. So, before I begin, I'll thank my friend Dr. Siddharth Banerjee, who has also contributed in this presentation. Um, right, as we were discussing, um, health is a concept that is kind of defined by not only well-being but also absence of disease. So what happens when we fall ill? Right now, I think the model that we have is that we either, if it's a infectious disease, we visit our doctor, get prescriptions, and start our medicines, get well. If not managed at home, then we go into the hospital and we get admitted there and get treatment there. So this model, where if you can see the departure from health in this chart, it's where illness and injury is conceptualized. So it can lead to two things. One is death, one is disability. Um, so when we talk about public health is basically the aspect where the discipline or the actions which people and society takes to protect, promote, and prevent health and well-being. So if you can see these arrows, the black arrows or the gray arrows, they are what represents negative change. So from moving from health and well-being to illness and injury is something that is negative. And then moving from there to death or disability is again a negative thing that can happen. And disability can also lead to death. At the same time, disability can also lead to optimal functioning. Like if there are systems that can help support the disabled individual to reach that state. So even again from illness or injury to health, we can come back to that. Again, that is where the system which supports our recovery from illness to or injury to health is important. So public health or a public health system is something that helps in dealing with these three aspects where we either promote health or well-being, we try to protect health and well-being, or we try to protect people from illness or injury. And at the same time, if because there will be illness, there will be injury, we also try to prevent the worsening of that illness or injury into a disability, and we also try to prevent deaths. So that is what the function of a public health system is. um, so I will talk a little bit about the essential functions of public health system. As you can see in this diagram, these are somewhat called the 10 essential functions. So there's assessment, there's policy development, and there's also assurance. So let me start by the assurance part. So in order to improve and provide a system that helps us stay well or helps us to return or be healthy after we've been sick, you need a strong infrastructure. That is what we saw during this entire experience with COVID, right? That a strong public health system can help provide support and help people fall ill. If that is not the case, then a lot of disasters happen. Again, improve and innovate through evaluation, research, and quality improvement. We'll come to this in the subsequent slides. Build a diverse and skilled workforce. Now, here there's something important. Why are we saying that a diverse and skilled workforce is required? It's also because, so in the current conventional health system, we have doctors, we have nurses, we have ASHA workers, we have the sanitation workers. So it depends on the kind of skills that one person possess, and these skill sets can be utilized in order to help them uh, perform certain roles. So that is where building a diverse and skilled workforce is required. Equity, the central part of it is equity, and there's also a function for enabling equitable access. The concept of equity I will define as trying to ensure that the system which distributes opportunities or which ensures that people stay healthy or helps them to not fall sick, that system has to remain fair and just. Trying to help people to get the treatment or the services that they need in order to stay healthy or not fall sick is what equity function does. So apart from these issues, which are more or less structural issues, there's also assessment where you need to assess what is happening. So I think everyone has seen the graphs that are being shared over media about the situation of coronavirus in India, the number of new infections, the number of people who are getting well each day, the number of deaths. So that is what the function of assessment and monitoring population health means. So you're tracking population, a healthy population, as well as you're tracking people who have fallen ill and trying to understand the size and burden of the disease uh, that is being that is affecting the people. At the same time, we not only is description of the problem important, but we also need to investigate why is this problem happening. So again, with respect to COVID, it is if people are not following the protocols, then you need to enforce uh, proper contact tracing, or sometimes we've also had to resort to lockdowns. So understanding these problems, why a disease is spreading or why injuries are happening, that is another function of public health. Communicate effectively to inform and educate. This is again where we see that the bulletins by the Ministry of Health and Family Welfare or organizations like WHO provide, they help us understand what is happening and educate us about what are the preventive measures that we can take in order to stay safe. What can we do in if we fall sick, etc. Strengthen support and mobilize communities and partnerships. So nothing happens in isolation. You have to work together in order to develop or pursue the outcomes that you want. So, for example, in the current public health system that is fighting COVID, we are doing so many things at the same time, right? Like we are trying to treat the ill, We are trying to vaccinate people at the same time, vaccinate the people who are currently healthy. At the same time, we are also trying to provide support to those who have been affected negatively by the effects of the pandemic. So all of this requires the effective cooperation between the system that is trying to help and the beneficiaries or the communities that are being helped. So this is again very important. Create, champion, and implement policies and plans and laws. So this is again another function that public health people provide, creating laws that can help, creating policies that can help in order to measure or in order to promote public health outcomes. And of course, utilize legal and regulatory actions. So now all of that is a lot of theory, I realize. So I'll briefly share a study that was done. Um, this is this happened in Chhattisgarh. So before that, the problem is of stunting. So I have because we have been talking a lot about coronavirus and it's a medical problem. Um, Primarily, it's a medical problem, and then there are other ways in which socioeconomic factors are also involved. So here, stunting is a problem where basically what happens is the child who is affected, they do not grow as per regular children. So the problem, so and this can affect both physically as well as psychosocially. So why is it a problem? It's because a stunted child can also give is already prone to a lot of disease, is already prone to a lot of infections. Apart from that, when the stunted child grows up to be a parent, as you can see, a malnourished mother, um, that person gives birth to a baby who's also underweight, and that again, uh, the cycle is basically propagated if you do not correct this stunting. So, Chhattisgarh, as you know, the Indian state, it was created in 2000, in the year 2000, and it was a very new state. Um, so, what had happened is stunting was a big problem during the when the state was created. However, when measuring the baseline from 2006 till 2016, Chhattisgarh ensured that as a state, it reduced stunting as a public health problem from 52.9% to 37.6%. No other Indian state could achieve such a magnitude of reduction in stunting. So the researchers tried to understand the how this worked, how this entire intervention of what brought about this change. Because in public health, we try to understand what the solutions that are effective, the solutions that can be replicated. So if this has happened in Chhattisgarh, we can replicate it in other states to help other children who to avoid being stunted basically. So here what has happened is the researchers tried to understand the factors which had helped reduce stunting. They found that health and nutrition services contributed to 17.5%. Improvement in socioeconomic status, again, that contributed to 11%. And improvement in sanitation also helped in reducing stunting. There were other social factors as well. There was also quite some factors which were unexplained, which could not be explained. So focusing on what was known, why I brought that is because I want to highlight that these problems, these social problems that have, as well as health problems that have been there, they take time. they take time to be managed and reduced. But at the same time, if there are there is a political commitment, if there is people who are actually trying and helping in the mission, then these problems can be managed and can be reduced. So this is how the policy structure of the reduction campaign works. So if you can see, in 2001, there was an advisory board that was set up. Mitanin program. So Mitanin is basically, in Chhattisgarh, Mitanin is known as a friend. Like it translates into a friend, and
Mm-hmm.
if you have heard of, or if you know of someone who's an ASHA worker, Amitanin has similar roles. So basically, what had happened is the government worked decisively in order to uh, help bring down stunting. They worked to empower rural women. There was political commitment that helped provide the stability for such a program to work. There was also external support because, like here, we can see that Center for Child Health and Nutrition (ICICI) had supported the Metanin program. There were support from the center and state, both combined. These Janani Suraksha Yojana, RSBY, all of these factors helped. Um, at the same time, there was also infrastructural strengthening, so special newborn care units, online reporting system, Mahatari Jatan Yojana that provided hot, attractive cooked meals for pregnant women. All of these changes basically helped uh, combat a social problem, and this was possible because people trained in public health and people knowledgeable in public health and people who were passionate about this problem came together and decided that this was a problem that needs to be solved. And this the problem is still not over, but at the same time, this sort of reduction was kind of one of the best in the states. It's one of the success stories in this regard. So I think a lot of you wanted to know about the scope of work in public health before the session. To answer that question, I would take a look at this picture, which is from the Institute of Health Metrics and Evaluation. So this is for India. What are the risk factors that essentially kill our people or lead to a lot of disability? So if you can see, malnutrition is one of the biggest problems, and it has remained the same at the topmost spot between 10 years. So this is one problem. Air pollution is again another problem. Wash means water, sanitation, and hygiene. On the other hand, there is high blood pressure. So this is another thing that is happening with in societies that are economically advanced or that are improving. Gradually, what happens is the levels of infectious disease come down and the non-infectious disease go up. This is something called epidemiologic transition. So here you'll see problems like high blood pressure, high fasting plasma glucose, which is one of the causes of diabetes. These things are increasing. At the same time, health risk behaviors like tobacco, alcohol use, all of these are also increasing. Dietary risks, high LDL, these are basically chronic illness causing problems. So when somebody asks me what's the scope, I think this figure has the answer. Each of these risk factors has multiple organizations and multiple governments working on mitigating these challenges, and that is where I think and these are just the most important risk factors. Apart from that, there are a lot of problem areas that public health professionals work in. So these are basically some of the important issues where public health people can and are contributing right now. So moving on to that, what does a public health professional do? So the goal is to improve health outcomes and reduce health inequalities. By health inequalities, I mean these problems where some people enjoy better health while others don't. And that's not due to a genetic fact predisposition, but more due to a, let's say, a social cause, economic cause. So that sort of inequalities can be reduced. So there are a couple of three broad aspects to this. A public health professional that can do. This is one of the maxims which I learned during my time, during my masters. In God we trust, or others must bring data, because data is important when it comes to understanding the scope of the problem and solving or working to solve these problems. So in terms of technical functions, measuring health and well-being is important. Like in the previous slide, I showed how the risks that are the top 10 risks that are causing deaths and disabilities. So trying to measure the amount of the problem is the first step to understand how to, or to try to set direction in how to solve it. So measure health, well-being, risks, inequalities, usage of services, how many people, so for example, how many people are getting vaccinated. If there are more people who are not getting, or who are not taking the vaccine, and what is causing the vaccine hesitancy. So these are the problems that public health professionals try to understand. Promote health, well-being, address the determinants of health. This is where I am currently personally working. In my work at Hopscotch Health, I try to understand what are the, as Saraveshwar was also saying, what are the health behaviors that can be improved by a person with the help of a mobile app. So we work in the nutrition space. So how can one get access to information on nutrition and change the, let's say there are nutrition behaviors which are detrimental to health. For example, you might be having excess sugar, or you might be having larger quantities of food than what you currently require. So understanding these problems and trying to help you in managing these problems in a culturally and contextually appropriate way is something which we are trained to do. Provide evidence-based advice, again, trying to understand what has worked in the past and replicating that with, while understanding the context as well. There's also delivery function where you need to provide leadership to the organization. Let's say if you have, or you are assigned a certain project and you need to deliver the outcome, so you take that up and you ensure that the whatever necessary actions need to be taken are undertaken. You have to maintain communication with the stakeholders, because nothing happens in silos. Design and manage programs and projects. So that's one of the most important aspects, where you need to understand and plan how these programs can be run. There's also working with and through policies and strategies, the understanding the context in which you operate. So, for example, trying to un, so if I say that, or if I decide that some intervention has is appropriate, but it's not probably relevant to the community. So that sort of, so understanding the community's needs, if a particular community is not taking the vaccine, or so understanding their fears about the same. So that sort of thing is that sort of contextual understanding is important in order to help mitigate it. So that is where again public health professionals understanding of both the health as well as social, economical, political context is important in order to solve these problems. Um, so before I go into this, are there any questions?
So if
Okay.
anyone would like to ask Debrishi a question, and till this point, if anyone does not have a question, Debrishi, if I may ask a
Sure.
question, and I think
Yeah, yeah. Please.
uh,
So
okay, I
I
think
have a question.
Sunaina has a question. Sunaina,
Mm-hmm.
please go ahead. Yeah.
Sure. Go ahead.
Uh, Good evening, sir. So
Mm-hmm.
actually, I wanted to ask that those who have taken the first dose of COVID vaccine, so
Mm-hmm.
like, uh, is is it means will it be protective enough? Ki second time it can't happen, or for it should be taken. Means like I have taken the first dose, so we have to take the second. Is it is very means is it necessary to take even for my parents
Yes.
or whatsoever my husband, all of us, my family members, is it
It
this is necessary or not?
yes, it is. It is.
Because
Both the
in these
doses
days,
are
sir,
important.
so we have to take both. Means and
Hmm.
some say that fever is coming, like we are having hand pain and things like that. So some symptoms are there, like. But sir, is it means it is mandatory in the today's time? It is mandatory to take vaccine. That so it's okay. But sir, means second dose, it is means after taking second dose, are we fully prevented from means it can't happen or something like that? As what do you
So
suggest?
I think the correct answer is that vaccines are a mode of teaching your immune system about preventing or mounting a resistance to the infection. So I don't think I can say, or anybody can say that after having a vaccine, there's 100% chance of not having COVID. But at the same time, vaccines are known to prevent severe and serious illness and death. So that is where, of course, we are also talking and trying to understand what is causing breakthrough infections and the complications. At the same time, it's imperative that taking both the doses as indicated is important.
Thank you, sir. Okay, sir. Thank you,
Saraveshwar.
Saraveshwar, sir, as well.
Yes, yes. Thanks, Sunaina, for asking the question. Debrishi, before I ask my question, I would like to uh, bring into your notice that we had some questions in the chat
Mm-hmm.
box. I would like
Mm-hmm.
to bring that to your notice.
Yeah.
Nikita asks, as underage marriage has effect on stunting,
Mm-hmm.
what's your opinion on increasing age of marriage for girls? She's asking you a question on the opinion of increasing age of marriage for girls. Do you have an epidemiological answer to that, Debish? Thank you.
So I think I again, because this is a policy related question as well, and from a as far as my understanding is concerned, I think the current uh, consensus on there has been a lot of discussion on these issues regarding increasing the age of marriage. At the same time, there are other, because stunting is not only linked to one factor, there are also other factors involved, like mother's BMI, mother's nutrition, mother's status in the family, mother's literacy. So these are there are various factors which kind of contribute. So I don't think that's one aspect where like it's not like increasing age or decreasing age would have an effect on stunting itself. There are multiple factors involved, and it's important that we have adequate data in order before we take these solutions.
Right. Thank you for answering that. We have another question from Samudranil Acharya Debrishi.
Mhm.
He's asking, after the prospect of a public health graduate in NGO and CSR sector.
Right. So I will be covering this in the later
Right.
slides.
Wonderful.
So
So I think the
yes, be with
Samudranil,
us.
you can yeah be with us. And I think
Yeah.
before you move ahead, also Debrishi, I would like to ask a question on behalf of everyone,
Mm-hmm.
which if you want you can answer now. You can even answer later on. You can sum it up
Mm-hmm.
for all of us. I
Mm-hmm.
want to ask Debrishi the most popular question which is being asked, that how much has the pandemic helped in leveraging the prospects for public health professionals, like how much has the pandemic created, as like being a public health professional yourself, like how much do you
Mm-hmm.
see an increase in opportunity in the sector,
Mm-hmm.
right?
Mm-hmm.
How much do you see an increase in demand with the professionals who are required to work? So if you want, you can answer it now. You can even answer it later.
I think it's important to bring to the discussion here that health is always important, and
Right.
no
Right.
matter how much you work, no matter how many people come in, there will always be need for people, more people. What is also important is the amount of importance shown to health by the entire industry and the system. So I think that has improved after the pandemic, because there's also realization that health is something that is not only managed by patchwork, it also needs serious systemic redressal. So that is where I think opportunities would gradually evolve more and also increase. And there's always a lack of adequate human resources when it comes to health, at least for now.
Right. Thank you so much. I think you
Yeah.
also hinted towards some behavioral change, right?
Mhm.
In
Mhm.
terms of stakeholders who
Yeah.
want to focus on health, right? Thank you
Mhm.
for answering that. Thank you so much.
Yeah. Mhm. Okay, I think Shubhangi has a question about, as we're talking about stunting. So, for girls, as a country like India, in the rural areas especially, girls are not taken care of properly. Boys are prioritized as well, or early marriage, sending the girls to work as a housemaid, etc. What's your take on this social aspect? Oh, absolutely. If something that has been clearly understood in terms of understanding these issues, it's that the role of women in improving the health of overall health of society is fa- definitely linked to their position in the society, in the family, in how much they participate in both private life as well as public life. So it's extremely crucial that girls are brought up in a manner where they have access to all sorts of opportunities that are given and enabled to boys as well. Then there are a lot of indices that are being monitored on the basis of women's participation, girls' participation, access to care. So that is where we do need to work a lot more. Definitely. Okay. So I think I'll continue for the rest of the slides. and we'll take questions again. So as I was saying, public health professionals do certain tasks. So there are certain elements that after you're trained in public health, you need to know. These are called core competencies. So basically, these are aspects which you are supposed to be knowledgeable in after you have been trained in public health. So I will not go into the deeper aspects because I'll just go over these a little briefly. So the first domain is global burden of disease. You need to understand the trends of how the how disease is caused, how much disease is spreading, if I can use that term, and measure that. And you also need to understand how to use that data in order to understand the health status of a given population. Apart from that, there's also globalization of health and healthcare, where we are in a system where the again coming back to this example of vaccines, um, vaccines manufactured in India is being sent across globe. So this is all connected, right? So that is what we also need to understand in order to solve the problems. There's also something called social, environmental, and economic determinants of health. So basically, health is not only affected or influenced by biology, but also, as we have been discussing about stunting and COVID. So we now know that health is also influenced by all these social, economic, and environmental factors. So we need to understand that as well. Apart from that, capacity strengthening, what this means is, uh, so let's say I am a doctor and I am working in a setup where I need to know certain things, but maybe let's say if I'm working in a village, I if I'm not trained in how to deliver or attend a delivery, then the people who are dependent on that health center, on that particular health center, they need to they will be referred to somewhere else, right? So in order to prevent such kind of instances where people are not getting the services that they need, you need to ensure that the health system has enough capability to handle whatever issues they have to address. So that is what capacity strengthening does. Basically, training and improving knowledge, skills, as well as attitudes. Apart from that, of course, ethics and professionalism, health ethics is a very important subject because you're working with people. There are certain values that need to be there while that need to be maintained. Apart from that, sorry, one second. Yeah. Um, so the other factor is communication. Communication is very important. You need to communicate and collaborate and partner with agencies and your other stakeholders as well. Health equity and social justice is something which you need to learn and understand in order to help others. Program management again is a managerial skill because you are in charge of if you work in this space, you're in charge of delivering certain outcomes or so, and trying to do that is also important. Apart from that, socio-cultural and political awareness is very important. Strategic analysis, trying to understand a situation in order to decide on what's the best outcome that can be achieved. And of course, you need to be trained and be proficient in research. So these are some of the skills that you get when you're trained in public health. Apart from that, there are also soft skills. The previous ones were technical skills. You need to be knowledgeable in how to manage time, how to manage stress, um, being flexible and adaptable, ability to handle critique, because essentially you're working with people. You might not get favorable reviews every time. So that sort of understanding and being able to handle that is important. Apart from that, also a value that needs to be there is empathy. It's a very core value when it comes to working with people, and of course, teamwork and communication skills. So, coming to colleges that currently teach masters in public health. So, this is a list which I picked from this paper where written by Dr. Zodpe, Sanjay Zodpe. He's a public health expert. There are a lot of colleges right now, and I think this is also increasing gradually over time as more and more people become interested in public health. More and more institutes are opening up in order to deliver training as well. So this is where I studied public health, Tata Institute of Social Sciences, Mumbai. Um, so we had a 2 years course. um, the competencies that I spoke about briefly earlier, that is what, and of course, college life is a great experience as well. So we had, apart from in class learnings, we also had a couple of internships where we actually had to travel to the field in order to understand and deliver certain deliverables. So that is where we actually got trained in the nitty-gritties and day-to-day aspects of public health, like how public health is actually delivered in field, apart from getting trained or studying it in the classroom. So the School of Health System Studies, Tata Institute of Social Sciences, has four health-related courses and one course in social work that's involved in public health. So in our school, we offer, there are around four programs. One is there are three public health related programs. One is Masters of Public Health in Social Epidemiology, which I have studied. The other two are Masters of Public Health in Health Policy and Economics and Finance, and Master of Public Health in Health Administration. So there are commonalities in these courses, as well as there are certain aspects which you learn exclusively in that course as well. So I think a lot of people were curious about this aspect. What does a public health professional do after graduating from the course? So there are two options. One is you can pursue further education, and of course the other is jobs. So under further education, the currently under the new education policy, the MPhil option has been discontinued. However, at the same time, we don't exactly know what is the current update. There's of course the option of pursuing PhD in any of the public health related themes. You can do it part time and full time as well. There are various universities in India and abroad which offer a PhD. Um, in terms of jobs, there are public sector jobs and private sector jobs. So we've divided the sector-wise overview into two different aspects: government, non-governmental, and intergovernmental, as well as corporate. So in the government sector, there are think tanks and research institutions. A good example would be NHSRC, the National Health Resource Center, Support Center. Apart from that, there are also various state health resource support centers as well. Niti Aayog itself is a think tank. Apart from that, there are CSR wings of various institutions, various corporate bodies. There are INGOs. By INGOs mean Indian NGOs, and by NNGOs, sorry, international NGOs and national NGOs. So international NGOs, there are various organizations. Even WHO can be said to be an international NGO. There's MSF. There's in the national NGO space. There's so many. Of course, there are also the governmental technical support bodies like the National Health Mission, NHSRC, UNICEF, of course, is there. Each state has its own Ministry of Health and Family Welfare, so people find employment in those bodies as well. Apart from that, in the corporate sector, there are few avenues that open. Some people find employment in pharma. There's also research options. There are clinical research options. There are public health research options as well, research institutes as well. There's also insurance. Some people work in insurance sector as well after completing a public health degree. There's also health IT, health informatics, and you can also be a consultant with various organizations in this sector. Decision wise, like what to do after MPH is something uh, I think the best way to answer that question would be depends on the person. What makes you feel passionate about? What are your goals as a person? What do you want from your job? So those are some of the questions you could consider. Other than that, I think a good idea to get uh, exposure about the different kinds of jobs available in the sector would be to go and check it out on LinkedIn. You could talk to people who are currently working in this space. You could follow their work, try to understand what sort of work they do, and get uh, your make your understanding better, essentially. So that sort of research is something which you could do on your own to understand the job sector and what interests you. So these are a couple of resources that we had compiled. This book, Factfulness, is something which uh, Hans Rosling was one of the first people I personally uh, followed on YouTube and tried to understand his approach. When I and that his lectures were something that made me curious and passionate about public health. Um, there are a lot of other books as well. Um, Apart from that, Twitter is a very vibrant space right now regarding public health discourse and debate. So there are a couple of handles whom I follow. You could also follow them as well in order to get an understanding about what are the issues and what are the um, debates that arise and that happen in public health. You could also get a lot of updates about how what industry leaders are thinking and what are they discussing. So you could also follow organizations like Niti Aayog and Poshan Abhiyan, BNGF India. So you would get a lot of exposure on Twitter as well. Apart from that, there's of course TED Talks, and if you are interested in short courses, you can go on Coursera or edX courses as well. I think Coursera has made a couple of courses free for Indian students. Check them out if you're interested. There are YouTube channels, and a lot of podcasts are also coming in these days about public health issues. There are a couple of other directions to explore as well. I myself was passionate about public health, so I followed that. I have a couple of other friends who have gone into these directions, such as MBA in health management and MSc in biostatistics. There's data science fields as well, which are currently coming up. MA, MSc in population science studies if you are interested in demography. And of course, you can also contribute by getting involved in the public services commissions as well. So the last take-home message from me would be that because we were discussing about careers and jobs, I think what is important is this Japanese concept of finding your ikigai. It's something where passion, mission, profession, and vocation collides, and it's supposed to produce the best best feeling that you can get and the purpose or find the purpose of your life. So if public health is one of them, then I bid you welcome and all the best.
Thank you, Debrishi. I think this really sums up the spirit of what we are all together participating in, and I would like to really thank you for simplifying many aspects of public health which were on the minds of students, and we do have quite a few questions on our chat box for us to look at. So, Debrishi, like I think if you would like to answer,
Yes.
uh, we have like
I think we had discussed about Shubhangi's question.
Shubhangi's
Yeah,
question. Yes.
yeah.
Then maybe
Soumya's question
yeah,
is, yeah.
yeah.
How will government and other stakeholders ensure that the lessons learned from second wave lead to a behavior change among the public, keeping in view the massive economic distress, especially amongst the rural households? So I think this is where you would get a lot of information and exposure about how these things operate on Twitter. People write a lot of policy briefs and a lot of petitions, and there's a way of doing public health activism, right? So that is where, and this is where these voices come in. And if you want to follow, I could share if there's a Twitter handle for Jan Swasthya Abhiyan, or there are individual activists out there who try to get uh, and highlight these issues either through media or through public interest litigation or through policy related work. So the best way to for us individuals to contribute would be to kind of follow their work, get to know what they're talking about, educate people around us, let them know that okay, this is what these people who are experts in this field are thinking, and kind of continue that conversation forward. Because at the end of the day, the more we speak about these issues in our social circles, the more ripple effects generate, and hopefully that will help in letting these issues reach to the government as well. Apart from that, I think Himani had a question. The pandemic has intensified disparity in accessing healthcare services. Women and children remain the vulnerable section of the society. There are policies or schemes to cover them and bring them under the umbrella, but a large portion still remains uncovered. How do we go about it? I think that is where you, as a public spirited individual, come in, and it's also how we individually, each of us, can contribute to this problem, as I said, by trying to find out what is happening, trying to follow and amplify the organizations that are working in this spread in this issue. For example, I think this particular question, women and children remain the vulnerable section of society. So I know of this organization called Shangjo, who currently work with the survivors of sex trafficking, and the amount of destitution and deprivation that these people undergo is something which is alarming. At the same time, there are these organizations and individuals who are constantly working in order to, and they're also empowering these people, because it's not only about going in and giving people some access to some service and then just retracting back. It's also about empowering the community in order to continue and strengthening their capacity to keep on articulating their needs and their demands, right? So I think from a very individual perspective, we can at least do try to amplify the work of others. If you are interested as a professional to contribute, I think the best way to do it is to get trained and get the adequate exposure, and then work in a professional capacity in order to help bring social change. Shubhangi also has asked, I want to know about the scope of a psychologist in coming future. As we know, the pandemic has brought a great demand for mental health professionals, but still people don't open up when it comes to mental health, and those who do are tabooed forever. Well, yes, I would not dispute that, but at the same time, things are changing. I mean, this is one of the best times to actually work and talk about mental health. And while there is still taboo, I think this will be countered the more we talk about it, the more we open up about it, the more we advocate for mental health and normalize it. I think that is very important and very crucial. Um, so in terms of scope, yes, there is scope. At the same time, I would rec- recommend and encourage you to do your own research as well. Try to talk to your peers, talk to other people who are working in this space, and do your own research and also find out what is happening, what are the opportunities. Sudeshna has asked, how important is women's health in the public health sector? Is there a specialization for this? And absolutely. I think um, we had an entire separate subject on gender and health. Uh, that is, I think, as a cisgender male-bodied individual, there, and that too with a lot of relatively a lot of privilege, I was quite unmindful of a lot of uh, how my privilege operates and shapes my experience. I think the gender and health class was one of the key elements which helped me understand and even conceptualize the problems that other people who do not share my gender experience face. So that you definitely can. There are a few. There are quite a few gender scholars, and there are a few organizations which are gradually working in this domain as well. So please look them up and get informed. And there's a lot of scope of doing good work. What is the role of social epidemiologist in CSR? In CSR, what kind of job profile do we get? What is the current job scenario in public health sector? Okay, so I think in terms of CSR, as far as my friends and my seniors or batchmates are concerned, they're all working in various capacities, whether as researchers, whether as implementers of different health programs, advisors. So, as I said, there are various ways to contribute, and people get involved depending on what is available and also what motivates them to participate. Um, okay. What are the research prospects in terms of rehabilitation sciences and occupational health and public health in future? Okay. To be honest, I myself am not too knowledgeable about rehabilitation sciences and occupational health, it is of course important. But I think I would encourage you to do your own research. And if you want more info, I can look up and get back to you on that. If one specializes in a specific course in MPH, can we not enter the other job profiles? For example, one does social epidemiology. Can they still enter into jobs related to management? Of course. So it, I think academically, whether you're reading a certain subject, that does not that is not the sole determinant of what you get to do afterwards. It's also important that you, because see, like this is what a friend told me, and I think this holds good. Is that a certain course of study or a certain course of discipline will give you a certain exposure and a starting stone. It will help you to acquire certain skills. The rest of it, or you will continue to learn. Learning is a lifelong process. You will continue to learn a lot while you're working. Like for example, when I was in MPH, I did not know much about behavioral science. It's what I found interest in, and I started reading about it while I was working in my control. So you would definitely get a lot of exposure, and a lot of understanding will evolve based on what work you're doing in the future. So it's not mandatory that you have to stick to whatever you've only read in the course. No, what are the best colleges to pursue MPH? Okay, so there are a lot of colleges right now. I would recommend you to do your own research, because, to be honest, best is a relative criteria. There are a lot of background criterias with which to judge, right? Right. Your where you're from, what sort of exposure or background you're looking for, what is your economic capacity. All of these come into play when we are making these decisions. So the more information you would get, do your own research, and find out what works best for you, is what I would say. If I have a,
Debrishi, if I
yeah,
may intervene once,
sure.
uh, I would just like to ask you again a very popular question,
Mm-hmm.
that how, by any means, is it important or not important, or is it ever connected to have some medical connection as a background,
Right,
be able to
right.
do well in masters in public health? If you can help all of us demystify
Yes,
that
yes.
understanding once for me.
No. First of all, no. It's not the sole criteria. What is, I think, what is important is a passion and curiosity about public health. So I sat in classes where my batchmates were from diverse backgrounds. We had engineers, we had sociology graduates, economics graduates. There were people from different branches of medicine as well. So the more diverse your, see, public health is about people's health. It's not about a specific discipline or a specific approach. It's
Right.
a interdisciplinary approach, right? So the more diverse your class is, the more different backgrounds you get exposure to, the more your understanding develops and gets enriched. So there's no absolute bar about background qualifications. You have to be a graduate, is what is important.
Right. Thank you for that answer. Thank you.
Mhm. Okay, if I do a CAPM certification, how will it benefit me in the job sector? I am sorry, I don't have an answer to this. I would have to do a bit of background research myself before I can answer this question. Sir, those who have to work for long hours sitting in front of computers doctor. How can we get rid of our back pain?
I think,
Well, I am one of them.
yeah. So I mean, most of us are, Debrishi. In fact,
Yes.
if you allow me, and Sunaina, to answer this question, like I think we would love to support you. We very fortunately have a physiotherapist in our participants, Dr. Himani Goel. So Debrishi, with your permission,
Absolutely.
I will ask maybe like a 1 minute or 2 minutes from Dr. Goel, if she is there active,
Please.
to share some her tips, Himani, for Sunaina, who asks us how can we get rid of our back pain. Thank you so much.
Um, okay, yeah. When I saw the question in the chat box, I felt like answering, but then I felt like, okay, first let sir give me the permission to answer. So first of all, this is the plight of everyone. Like everyone is sitting in front of the camera or screen for hours. So when you are starting your day, I would recommend you to start with stretches, like back stretches. If you are into yoga, try doing few poses. Like I am not really aware of the yoga postures name, so maybe you can look up, but you can do back stretches, like where you can go into child pose. That will really stretch your back muscles. So if you have to like sit for like 5 to 6 hours, that will give you like that will strengthen your basically muscles, back muscles. And one reason for your back pain is because your core is not that strong. So I would recommend you to work on your core, like do some core exercises. You can do bridging exercise. Like bridging is you have to lie down, and you have to fold your both legs, and then you have to lift your back to 40-degree extent. That will help you build your core. And when you are sitting for like if you have to sit for like 4 to 5 hours, I would recommend you to take a break. Like if you have to sit for long hours, take a 5 to 10 minute breaks, and then you can do a little stretching. Like you can turn, rotate, you can just bend down and backward. That will help you stretch your muscles. And also you have to be very specific with your chair. You cannot like there can be restraints, but then you can make it according to your comfort. Like you can put a pillow on the backside. Make sure you're sitting straight, you're not slouching, because that puts more pressure on your muscles, and your muscles have to work more. So try to incorporate few exercises in your routine, and that will help you get rid of your back pain. Yeah, that's what I would like to say. Thank you.
Thank you so much. I think that was such a value add-on to our discussion on health in this session. And thank you, Sunaina, for also asking that question. Debrishi, I think we have some little time left. If
Yes.
you are not burnt out to answer questions, maybe we can take a couple of more. Yeah. Thank
Hmm.
you.
Yeah. There is a concern people who are graduating, recruiters asking for 4+ years experience. How to tackle this? Well, I think if I remember back to my days of interviews regarding the job applications, I think there are roles that will be requiring certain experience. There are roles that will be for freshers as well. So if there are concerns about recruiters asking for work experience, I think maybe look out for roles that are meant for fresher jobs. At other than that, I'm not sure if there's anything else that can be done at this point. Which colleges are there which give part-time PhD programs? Well, there are various colleges. My own college, Tata Institute of Social Sciences, they have options for working professionals to pursue their PhD. Um, there's, I think, also there's a possibility that Jindal University has such a program, but that I'm not exactly sure. So I would again recommend you to do your own research and find out. Any tips for OPI for TISS MPH? 1 second, sorry. aspirants, how much information are we supposed to know? In-depth knowledge about current affairs, health indicators, stats percentages. Since seats are less, what can give us an edge in the interview? Well, I think what is important to know is you should at least have a good understanding about the current status of the health system. Try to find out, if you can't remember stats or percentages, at least try to get your concepts clear about what those stand for. And also, yes, current affairs and health indicators are important to know. They, like, try to find out what are the some of the important indicators, like, let's say, maternal mortality, infant mortality. These things are quite important. As a public health professional, at least when you're trying to prepare for such an entrance, it's important to know some of these baseline indicators. Try to read about the SDGs, the MDGs, the current situation of health in your state, and I think that's enough. Okay, as we are talking about mental health, how can we deal with negativity like negative thoughts? I'm sorry that you are facing such issues, and I think the best way to deal would be uh, find out. There are a couple of helplines that are trying to help people with mental health issues right now. You could try them out, and also try to seek professional help if it does not address the solution. Um, okay, I think that's it.
Right.
Yeah.
Wow. I feel one of the pretty key takeaway points which I would like to re-emphasize on behalf of Debrishi's presentation is that number one, health was before the pandemic and even after the pandemic or during the pandemic always important. Demand for health professionals was always there. What Debrishi highlighted very interestingly, that the pandemic acted as like an advocate for the stakeholders, to prioritize their investments towards the health uh, in their list of priorities. I would, if I would like to highlight that. So that was one pretty important takeaway, which I felt that was important in terms of the session. The other important point, which I would again like to re-emphasize on behalf of Debrishi, is that there is absolutely no rule that you have to be from a medical background or a medicine background to be able to pursue like a master's in public health, or to become a public health professional per se. It is so much about the passion that you exhibit, due to the institutions and to the recruiters when you are wanting to study that. And of course, like as the Rishi's presentation also highlighted to all of us, the level of clarity towards the sector, which is pretty crucial. The biggest aspect which still remains with all of us is that health is a multidimensional sector. It is a multidisciplinary sector. Public health is an interdisciplinary sector. Every stakeholder, every individual from different backgrounds, different competency, different industrial sectors have a role to play in contributing towards public health. Debrishi, again, I mean, this has been like a, a breeze of a session. We spent 1.5 hours, never felt like, because you demystified, you simplified a lot of crucial parameters connected to public health to all of us. And as you rightly mentioned, that the conversation, these discussions, they will have some ripple effect even to stakeholders like the government, so that they take cognizance, and maybe the approach towards health can be re-strengthened for all of us. Participants, thank you so much for turning out in numbers for this session, generously enriching the session with your questions. And I think uh, uh, Debrishi thoroughly enjoyed answering the questions. Debrishi, thank you for answering them. I mean, you did not want to miss or skip any one single question, I would say. So thanks a lot for your time, and we wish that we could have kept on discussing, but we have hit the time when we have to round this session off. But I can definitely uh, ensure everyone that this is, again, as we keep on saying, the start of many more conversation, many more discussion, many more opportunity that will be coming up from our end at Catalyst. And we will also be taking the feedback from all of you. Shortly after this session, there might be some more questions that we would love to run by Debrishi, if that's feasible from our end. And we would love to take this onwards, to a very, very constructive way, so that more of us in our career choices, the objective for which we are doing the session, consider becoming a public health professional as a very exciting mainstream opportunity, right? In the days ahead. Thank you so much, Debrishi, once more on that note, for being with
Thank
us
you.
in this
Thank you
session.
for having me and giving me an opportunity to share my thoughts. I am also happy to see so many people enthusiastic about health, thinking about health, and I hope some of you do find the passion to take up public health and serve this country and help us become a healthier nation.
Truly appreciate. Thank you so much. Thanks a lot, everyone, for being here. Stay well, stay safe, and we will catch up very soon with more interesting